Ladies and gentlemen, we now move on to the last session of today's webinar, Partnership, Community Engagement, and Education for Mosquito-Borne Disease Prevention. This session will highlight valuable lessons from Indonesia and Malaysia, as well as insight into strategic partnerships and future directions in vector control. These sessions will be moderated by Dr. Andono Ahmad, Master of Public Health, Doctor of Philosophy, Dr. Riris Andono Ahmad, or we usually call him Pak Doni, is a lecturer at the Department of Biostatistics, Epidemiology, and Population Health here at the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, Indonesia. He is also the leader of the Neglected Tropical Diseases Working Group at the Center for Tropical Medicine, UGM, Indonesia. He is also the program coordinator for postgraduate program in tropical medicine, Faculty of Medicine, UGM Indonesia, and currently he is an investigator in the implementation of Wolbachia technology in 5 cities in Indonesia. Without further ado, ladies and gentlemen, please welcome Dr. Riris Andono Ahmad, Master of Public Health, Doctor of Philosophy. Pak Doni.
Hello, good afternoon.
Good afternoon, Pak Doni. The screen is yours, Pak Doni.
Thank you very much, Mbak Rima. Good afternoon, everyone. Good afternoon, distinguished guests, participants. It's been a pleasure for me to be here, and I hope you still have enough energy to follow this very important session. After we listen and discuss about science and technology required to control vector-borne related diseases, now we come to an end, which I think it's also very critical for the technology can be used by the end users, the community. So now in this session, we will discuss about partnership, about community engagement, and also about educating community so that they can use and apply the technology that we have for an effective vector control or for effective disease control. And we will have 4 speakers, which will discuss everything about partnership, community engagements, and education. I will start with the first speakers, which is Dr. Ivana Alona. She's from Universitas Sumatera Utara, and she will present a topic on malaria zoonotic, communities lesson use, and behavior in areas at risk for zoonotic malaria in Indonesia. She is currently a lecturer at the Department of Public Health, Community Medicine, and Family Medicine Medical Faculty, Universitas Sumatera Utara. She is also the Director of Education and Training, Research and Cooperation, Universitas Sumatera Utara Hospital, and also currently conducting research on health system enhancement for pandemic preparedness in Indonesia. Dr. Ivana, you have 15 minutes for discussing the findings, and the time is yours.
Thank you, Dr. Andono, for the nice introduction. Welcome. It's a great opportunity for me to share about our study regarding community engagement for malaria, zoonotic malaria control. Let me share my screen first. Okay, welcome all to my session. It's about our study in understanding community agricultural practices and behavior as risk of zoonotic malaria transmission in North Sumatra and North Kalimantan. As the outlines of my presentation will be introduction of zoonotic malaria, zoono study, community engagement, and One Health approach in zoonotic malaria control, field lesson learned, and key message. As the introduction, as previously provided by the previous speakers, Plasmodium knowlesi is the primary cause of zoonotic malaria, which is transmitted by monkeys, especially in Macaca fascicularis and Macaca nemestrina, through bites from Anopheles leucospiracis mosquitoes. And The first study was conducted in Sarawak, Malaysia in 2004. It is found a significant number of human phenylacy malaria infections. And the zoonotic malaria has been significantly increased in Southeast Asia, including Indonesia, where the PCR confirmed new phenylacy cases was reported in Aceh, North Sumatra, and Kalimantan. On the right side of the screen, we can see a figure illustrating the high prevalence of phenylacy, which is identified through molecular detection, marked by the purple colored zones on the map. Okay. This is the dynamic of zoonotic malaria transmission. When the vectors of a mosquito infected by the phenylacy, it can have a spill over to the community, especially to the community who live in close contact with the macaca, and it's because due to anthropogenic activities such as deforestation and land use change, so it can have increased the transmission of zoonotic malaria. So there's a need to understand a relationship between the agricultural and use change practices and behavior with risk of zoonotic malaria. To address appropriate preventive measures, adequate community engagement to control the transmission. So we have a study, this is a collaboration study with many collaborators from all over the countries. It's called Evaluating Zoonotic Malaria Transmission and Agricultural Use in Indonesia, which is abbreviated with ZooMal study. The project aims to strengthen surveillance of zoonotic malaria in Indonesia, evaluating the disease burden, agricultural land use, monkey host, and mosquito factors, to inform public health control efforts and facilitate sustainable agricultural development. We conducted the study in 2 provinces of Indonesia. It's in North Sumatra and North Kalimantan. So there are 3 objectives of this study. The first objective is to improve detection methods for zoonotic malaria surveillance and use them to define the disease burden. And the second one is to evaluate agricultural and land use factors associated with zoonotic malaria transmission. And the third one is to evaluate mosquito factors transmitting zoonotic malaria and the association with agricultural land types and practices on their behavior. So there are 5 districts that included in our study, 3 districts in North Sumatra. There are Langkat, Dairi, and South Tapanuli district, as you can see on the map. And in North Kalimantan, we conducted the study in 2 districts. It's in Nunukan and Malinau district. So the team of our study is quite large. It almost involved to 60 collaborators that mainly investigators comes from M.Si School of Health Research, from Australia, from Eijkman Institute for Molecular Biology, Professor Rintis, and from USU, Dr. Inke Lubis. So there are multidisciplines in our study. So it comes from clinical, from human surveillance, epidemiology, geographic expert, agricultural land use expert, environmental experts, macaque expert, and mosquito factors experts, and also social science. So the study has mixed methods. It's a qualitative and quantitative methods. We collect the data using key informant interviews and focus group discussions. There are 67 key informant interviews. It included stakeholders from government, from religious leaders, from patients, from the PK cases patients, and also focus group discussions with the land workers, women and female and male, and then the owner of the plantation, and landowners. We also conduct observation, literature, and government documents. It's part of our data collection. We use thematic analysis using in vivo software, and we keep on doing integrating discussion with other ZooMal components to confirm our findings and then to support the findings so that we can address the findings accurately. And the study duration started from January 2022 to December 2023. Okay, so we move based on from the information that has higher prevalence and from the satellites and from health facility surveys. So that's when we start the finding the informants and the participants. So it included from the government aspect, health sectoral workers, community leaders, pesticide sellers, PK cases, local NGO, company plantation, and hunters and malaria patients. So as the result, we have some themes on our results. So we found that the land use change drives from several aspects. The socio-economic is most reasons why they do land use change. And then the need for the economic growth through the plantations, and then there are change of land ownership from small-scale company to a large-scale company, and then also the program from the government, which included transmigration a long time ago for several years, and then population growth and need for land, and there are also dualism of perception of land use change. Some individuals say it's provide benefits for them to have their land use expanded because they can have good infrastructure. They say they can have good access to far areas in only for short-term period than the previous, that before the land use, before the area was changed. And then why it keep on happened? Because it not only there are policies to restrict the people to come to the forest or land to do the land conversion. There are some weakness because it really relies on the people's economic dependence, because they still need to seek their money through selling their products from the forest. And then there are traditional land use and community practices in the forest. And then there are weak or inconsistent policy enforcement, because it's a very wide area that the forestry government say that they have only limited resources, and then they only have limited amount of money for controlling the area, the wide area. And also the history of land use and the conflict between the tokoh adat and the adat land and then the new ownership. And then there are also about corruption and coalition from local elites profiting from forest exploitation. This caused the deforestation and forest fragmentation in some areas in North Sumatra and North Kalimantan. And also the land use practices that increase the vulnerability to mosquito bites and zoonotic malaria transmission. There are daily movement to agricultural workplace. It takes 2 to 6 hours every day to move from one side to other side, and sometimes they extend their stay in the workplace area, and then sometimes they stay overnight during peak harvesting period. For example, for the durian harvesting, they will stay in their hut with limited mosquito protection. And then there are risky location of plantation because there are body of waters, and then there have seasonal mobility and shifting cultivation, and also they practice inadequate water storage and waste management. And also, it is found that the community has a very close interaction with monkeys, because they sometimes in South Tapanuli, they keep the monkey as their pets, or they can target the monkey as the captured, and then they can eat that. Some of them also utilize the monkeys to climb the coconut trees and then provide the trees as the product that they can sell and then get the money from. And then they say that the monkeys really increase nowadays. It's very close to them. Sometimes the monkey can come to their houses. And then the shifting of monkey behaviors, they can find sometimes the monkey will eat snacks from kids. So that's happening in the Langkat and South Tapanuli. So sometimes the community also said that the monkeys are threats to the community's crop. So their practice of risky and poor land use management will change the wildlife movement and behavior, which finally can increase the vulnerability for zoonotic malaria transmission. And we also found that their poor pesticide use experiences, we tried to understand what they do in using a pesticide. They mix with ineffective pesticide using, and then they use inconsistent protective measures, and then they also have limited trainings and knowledge on proper application for pesticide the plants, and they store the pesticide not in a safe place, and the containers can just thrown away on the land, and it can have pesticide health risk from the pesticide residue. This will cause disruption of natural mosquito control. The amount of the vectors, the predators of the mosquito can be reduced, and then the number of mosquito will be increased in the area. And it can also pollute the environment and decrease the biodiversity. Sorry. I'm sorry. And then there are also underestimation of mosquito bites to health risk. So their number of high mosquito presence in the plantation. And then the perception of the workers or the communities just saying that mosquito are just annoying animals, not a dangerous animal. And then they have relaxed attitude towards mosquito bites. They use just sleeveless shirt, and then they stay outside at night without any protection, without any mosquito repellent. And then they say why they do that, because they say it's uncomfortable using the repellent, and then they use the bed not regularly use the bed net while sleeping. So this will increase the vulnerability to mosquito bites and zoonotic malaria infection. And then the perception of the community of malaria and the treatment, they can recognize the malaria symptoms because it's very often in their area, but they estimate of malaria's severity. They say the malaria is associated with mental health sometimes, and then they have self-limited administered treatment, and say they also delay the diagnosis to find the health facility and seek for clinical treatment. And they also practice traditional healing. So they rather use herbs and plantation according to the cultural that they believe. And then there is also issued about the skepticism towards formal healthcare providers. This will increase the malaria severity and the resistance of the malaria treatment. So these are some documentation that we can pictures from North Sumatra and North Kalimantan. There are conversion land in North Kalimantan, and then we can see the community, the worker in smallholder working without any shirt, stay outside the house, and then also palm oil workers in Langkat without wearing any shirt. And then they sitting together in the plantation while having lunch. And then these are the settlements of the plantation worker in North Kalimantan. It was previously a forest, but then they changed the plantation into a big company, and the company put a settlement inside the forest and then grow palm oil. And then this is a situation where the Pinolacea patients has a water body under the houses, and they're practicing for water storage and water supply. They say it's okay to open the water storage because they need rain, and then they don't have to go very far to get the access of the water. So they intentionally open the water storage. And they also really have close contacts with the livestock. They raise the animals, for example, cows and chickens. And we can find a lot of macaques foraging on oil palm trees in Langkat. And one of our fellow collaborator found Anopheles balabacensis inhabit forested areas in Langkat. And in dairy, they from the Pinolosi cases, they also has a chicken farming as their source of income. This is the picture of workers that spray the plantation, spray the pesticide without proper protective measures. And this is the various of pesticides that are sold by the pesticide sellers in the community. It's very easy to get, it's very easy to access, and then they can mix in whatever they want, and then it depends on who recommends what pesticide that's better for any of the parasites for their plants. And this is the over-the-counter drugs that is sold free, so in warung without any observation, and then without appropriate seller or distributors. They already put in a package medicine. It contains corticosteroid, antihistamine, sometimes antibiotics, or analgesic in one package. It depends on what disease that you have. For example, if you have cough, you have disease, fever, and you have pain on your muscle, so they can just choose the package and give it to the individuals that need medication. So this finally increase the community vulnerability to zoonotic malaria. So we need appropriate approaches to engage community integration and partnership to have a sustainable land management, wildlife conservation, and the development of public health strategies that aim at preventing and controlling zoonotic malaria transmission. Although we haven't tried to implement any of our findings to train or to have a pilot test to try to participating, to implement the ownership of this is control. So we still try to move to that phases, but at the moment we are trying to recommend to provide the prevention and the control to the policy in Indonesia, in local and to national, because we already conducted a dissemination to the stakeholders in the local, in Sumatera and in North Kalimantan, and we also invited the Ministry of Health last time, but we haven't tried to implement or provide the any of the examples of community engagement in the two of the provinces. So there are key principles for having community engagement for malaria control. It needs local leadership. Why? Because we want to have the local or the leaders for an implementation comes from the local, because they're trusted and they need people who own a specific engagement and programs. So we also need to have active participation. So we want the community to be the member, actively part of the implementation. So they will have their own decision, and then they can choose whatever suit them. And then it should also culturally relevant, because it will be acceptable and then effective to implement in the situation and in the local rooted condition. And for the community engagement, it also needs self-reliance, meaning that the program should encourage the independency of the to build the capacity and the sustainability for the malaria control without relying on continuous external support. And of course, for zoonotic malaria, we need a one health approach with link not only to health or clinician aspect. So we need to coordinate, communicate, and collaborate with different aspects or multidisciplines such as human, animal, and environmental health and others to achieve the best solution and health outcomes for not only for the people, but also for animals, plants, and the environment. So there are key points of integration, for example, that I tried to identify from some studies. It can be such as a community-based malaria surveillance. So the community can identify, for example, potential hotspots and then try to have their own reporting by knowing the symptoms in areas where human-animal interaction are prevalent. And we also need to conduct training and education, especially about health education programs that should be designed locally rooted and culturally appropriate to the environmental context. And we should also have a program of sanitation and water management and also pest management strategy. For the integrated One Health approach, we need a community to have their own monitoring for the environmental changing, and then they should collaborate with wildlife management initiatives, and the communities should also have a planning to have their own land use, prioritizing not in economic growth. So we should consider about the economic for their sustainability and also related to environmental health. We also need to increase awareness that focus on mosquito bite prevention and the seriousness of malaria. There also need to have a strategic collaboration with local leaders. So the community leaders and local health workers should work together and bridge the community to communicate the importance of both environmental conservation and personal health behaviors. What we can learn from our study, we need to communicate because it is essential to keep good lines of communication with the team and also stakeholders to say this whether the program already appropriate or not, feasible or not. And for the communities, we still need to have a good relationship to get the local data, local information, the right information from the communities that can be trusted for our findings. And from our experience, it's very hard to find the home.
Ibu Ivana, you have 1 more minutes.
Okay. So it's difficult to find the home address because there are migrants. They are not living in a certain place for just very a long time, very short time. And we need to have a ground truthing to find the differences, the local condition. So the key messages of our study, the One Health approach has benefit to understand zoonotic malaria because it considers the bigger picture. We can collaborate, communicate, and coordinate with stakeholders and the community. And then there's importance to understand local conditions in terms of local social culture, land use, human movement, and treatment-seeking behavior. And we also need to integrate a sustainable land management, wildlife conservation, community engagement, and improve public health strategies into national and local policy. And we need to have more socialization about malaria prevention and zoonotic malaria in the risk areas. Okay, that's from me. Thank you very much for having me in the webinar. These are our collaborators, as you can see, and you can contact me in this email. Thank you, Prof. Andon.
Thank you very much. I think this is very interesting study, which shows that the economic needs combined with traditional practices in land use and also traditional practice in interacting with wild animals increase the the risk of transmission in malaria, and there are pathways which is culturally sensitive to engage the community in a disease control. So thank you very much, Ibu. I would like to move on to the next speakers, please. The CV. So the next speaker is Ibu Nazni Wasi Ahmad from the Ministry of Health Malaysia. She will present a topic on Wolbachia strategy for dengue control, insight from Malaysia. Oops. So the time is yours, Ibu.
Can you hear me?
Yes, clearly.
Okay. Thank you, Dr. Riris. Assalamualaikum and a very good afternoon to everyone. I'm from the institute, which is 125 years old. Let me minimize this. Okay. So, this is the new look of the institute. And you all should know that the deadliest animals in the world is mosquito. And mosquito kills man more than man killing man. And the first dengue case was reported in Batavia at that time, now known as Jakarta, in 1779. The dengue hemorrhagic fever, which is known as severe dengue by WHO now, was first detected in the Philippines in 1953. Okay, this is the scenario of dengue cases and mortality in Malaysia for the past 17 years. And the circulating virus now is dengue 2. There's no switch yet. The key issues for dengue is there's no specific antiviral medication, no effective vaccine likely to be available. Current strategy for prevention is community-based integrated mosquito control. And as low as 2 to 3 female mosquitoes Aegypti are enough in a locality to cause the transmission. Although still widely used are chemicals, biological, and environmental management techniques, the overall problem still remains challenging. And of course, source reduction is the mainstay. And if everyone can do is the cheapest way of reducing the vectors. And in fact, the methods for controlling vectors is found in all stages of the mosquitoes. Is it impossible to find the last 10% of the cryptic breeding sites? And even worse now, with the beautiful plants grown at the houses, semi-indoors, it's even worse. The problem becomes worse because the bees has got nice places to breed. So therefore, we use mosquito against mosquito. And you all know that the traditional control measures are already in place. So what we are going to share with you is the Wolbachia mosquitoes for dengue control. Wolbachia is not a silver bullet. And the title of my presentation is Wolbachia Strategy for Dengue Control, Insights from Malaysia. This is the team. Our collaborators were Dr. Stephen Sinkins from University of Glasgow and Professor Ari Hoffmans from University of Melbourne. And WHO says that there are 3 innovative strategies we should be using for dengue control, which is Wolbachia, sterile insect technique, and transgenic insects. We have worked on all these 3. We have already published paper on SIT and transgenic, but what I will be sharing with you today is only on Wolbachia. I'm not going to say this because Dr. Chitra has already mentioned, but just to mention that in Aedes aegypti, there's no Wolbachia. So microinjection is needed to transfer the Wolbachia bacteria into Aedes aegypti. And to date, there's 9 strains in the laboratory, but only 2 strains has been field released for replacement and suppression. The field release strains are the WMEL and the WALB-B. And in Malaysia, we are using WALB-B, which is from Aedes albopictus. The strategy you all know very well. There's a replacement as suppression. And Malaysia went for replacement strategy. This is one of the reasons is because the number of mosquitoes required for release is very small, and Malaysia is a big landed area, as is a bit difficult to do suppression. But for suppression, the number of mosquitoes required is a huge number of mosquitoes are required. And Wolbachia suppress transmission of dengue, Zika, and etc., and has been documented in various publications. How does Wolbachia spread into wild Aedes population? It's easy. It's through mating. Okay, if a female mates with a Wolbachia male, there's no viable eggs, and if a female Wolbachia mates with a male, that's where the progeny spreads. So replacement strategy involves releasing both females and males. Wolbachia Malaysia has been funded by Ministry of Health as well as Wellcome Trust, and these are our collaborators. The research phase began in 2017. Actually, it started in 2016 with the community engagement, and up to now is still on. And the operational or the implementation phase began in 2019, and it's already 6 years with 53 operational sites. Community engagement is the most important, is a prerequisite for any kind of a mosquito release program. So our working principles were we have to have trust with the community, transparent, accountable, and we have to listen to the community. We have got banners, we have got posters, brochure, bunting in our release sites. We also briefed the Mufti of Wilayah Persekutuan because we had got a very bad experience with our transgenic mosquitoes previously, and we explained to the Mufti all about our Wolbachia project, and the Mufti gave green light by saying that, oh, this is a good mosquito, please go ahead and release them. We also have a launching of the Wolbachia lab in 2017, where we call the community to attend this launching, and we bring community to our laboratory to have a first look of the science of Wolbachia. All in all, we have got 40 stakeholder and public engagement activities conducted. From the bench to field, it took us 7 months. And once we have released the mosquitoes, we update the community by calling them to IMR. We explain to them the frequency of Wolbachia. We show them the dengue cases reduction. And we also have surat berita from time to time to be sent through WhatsApp to the communities. The work by the Institute of Behavioral Science was so good that they have convinced the community so much that when a mosquito lands on a community's hand, they will not kill it because they said it's a good mosquito. But we advise them otherwise. The main ingredient in our recipe was this is our project. After releasing, we also have a feedback post-release release survey, and we found that the community was very confident with the dengue cases reduction. So this need to be continued. So just to show you this, these are our research release localities, all in all 12. And we have got operational or implementation localities, 53 sites. So in all, the total population covered by Wolbachia in Malaysia was almost 300,000 population. The criteria was dengue hotspots, good public cooperation, presence of Aedes aegypti, high population of species, which means aegypti. Area should be at least 0.6 kilometers squared, accessible by road at all times. The process of Wolbachia release is, the first thing to be done is community engagement, and then continued by fogging. We will fog the place so that the mosquito population will be reduced. Then the mosquitoes will be brought and released in the field. We have got a few types of localities. We have got small area localities. We have got medium area and large area localities. We monitor, then we will see the frequency of Wolbachia. The field evaluation, the endpoints we measure was entomological endpoints and epidemiological endpoints. So what we noticed was from our research was that when we started to release this, we found that in just 12 weeks, the whole one of the localities, which is Montarikot, the whole area was covered. But within 3 weeks, the invasion occurred, has already started to occur. That means they're already establishing in the real field context, in the real field situation. And this is also to show you some of the graphs about the Wolbachia frequency, which is in blue. Aegypti is in orange and elbow is in green, and the red bars here are dengue cases. You can see that before the implementation, the cases were high, but after the implementation, there was cases, not to deny that, but it was lower. It was much lower, and the release periods was very short. Similarly, you can see the same thing in other localities. But the beauty of this was once there was case, the frequency dropped, but the frequency pick up by itself, not releasing any further extra mosquitoes. There was a reason behind. I will share with you later. And this has been seen in all our localities, most of our localities for the research. We have seen this, that we don't have to do any kind of a booster releases. So was there an increase in Aegypti and Albopictus population structure? No adverse effect was observed in both strains. There was a spike of Aegypti population, in fact, was a bit on the lower density. This was because there was no spike, but this was because we released male, and the male mosquitoes causes the cytoplasmic incompatibility. The natural balance between Aegypti and Albopictus was being maintained. So this is the results of our research localities, and we see that the reduction of dengue cases was from a 46% to 84% in the localities where we have released the mosquitoes. But we didn't stop release at one locality, we normally expand. And we also make sure that we take into consideration the natural boundaries and the building types. So we fill up the pockets. If there are localities which we have not released, we try to release in these localities to have a bigger area for release, so that the stability of the Wolbachia mosquitoes will remain. So from our research, we found that after achieving 90% Wolbachia frequency and conducting prolonged releases over a certain period helps ensure long-term stability. So frequencies do not decline drastically. To support these releases continued for additional 4 to 6 months. And this approach was the rationale for avoiding booster releases. And when Wolbachia frequency declined, no additional releases were conducted. Instead, the frequency increased on its own, supporting more consistent long-term establishment in these localities. We also collected the mosquitoes from the field where we have released the Wolbachia mosquitoes, and we have fed with the viremic blood for dengue patients from the hospitals. And the findings, we found that virus replication in mosquitoes were inhibited or reduced, and this has been published. So the important research findings was the release of Wolbachia infected cell was able to reduce dengue transmission. The dwelling, type of dwelling is important, natural bound is important. And the most important point I would like to say here is point number 5. Added value of Wolbachia strategy is its ability to overcome the transmission of dengue virus coming from asymptomatic patients, which are considered very difficult to detect. We have published our paper in Current Biology, and we have also published in iScience. In iScience, we have also considered our research as well as our operational sites, and we have found that if Wolbachia frequency is 100%, the reduction of dengue cases is 75.8%. These are all the papers we have published. So once seeing the convincing effect of Wolbachia, the ministry was very happy to take this into operational sites. It was announced by the Deputy Prime Minister at that time in 2019. So we started with little number, but we grew. So today we have got 53 operational localities in 6 different phases. We have SOPs for our operation or implementation. This is to ensure that every state which is conducting does the same thing, so that we can do comparison. Okay, before we start, we have got 3 committees in the Wolbachia management, which is the Site Selection Committee, Working Group Committee, and Technical Group Committee. The Site Selection Committee will be sitting in once there is a new locality coming in, and we will look into all the profile of the locality. Then once it has been done, then we will start with the release of the Wolbachia mosquitoes. So in the 2 years program after release for the implementation, we found that 60 to 100% reduction in dengue cases was observed. And in Kuala Lumpur itself, the frequency remained quite high, within 90 over to 100%. And we also found that 71% of the localities cases were below the annual target. And in these 13 operational release localities in Selangor, most of the localities had lower cases compared to before the implementation, as you can see in this graph. The percentage reduction in Selangor was in the range
Dr.
of
Nazni,
yes.
you have 2 more minutes.
Okay. We have 10% to 78%. This is what we do in during our working committee group. And also once we discuss each and every locality, and once it's okay, then we will go to the technical group. But we must understand that antibiotic contamination of water could cause stability problems. So that's the reason why if there is a drop in the Wolbachia frequency, we need to investigate what is the reason. So experience is the best teacher, and the worst experiences teaches us the best lessons. So the lessons learned was when we released our Wolbachia in one of the sites, the first release sites, we found that there are so many cases coming in. Then we found that what is the source of infection? Where is the source of infection coming in from? So we found that it is from the PKNS flat nearby, which is only 20 meters. So what we did was we released the mosquitoes there, and the cases came very, very much less. We also noticed in one of the sites that this orange is our control locality, and this became the hotspot. So what we do is we release Wolbachia here instead of fogging, and within 6 months we can see the reduction of cases. So the lessons learned, overall lessons learned is Wolbachia alone is not a silver bullet. Community engagement is critical. Monitoring must be more frequent. Effective interagency coordination is essential. Source reduction must continue. Broader release coverage is required to see the real impact of Wolbachia. Ideal dengue vector control tools should be scientifically proven, affordable, and sustainable. We are happy that the Minister of Health as well as the Deputy Minister of Health are both encouraging the use of Wolbachia, which is in our recent in recent papers. In fact, in the Form 5 book in Malaysia, there's also mention about Inovasi Malaysia, which is usage of Wolbachia mosquitoes. We have outsourced our Wolbachia production to Success Beacon, and this is a private partnership, public-private partnership, a collaboration, and hopefully it is a successful collaboration. With this, I would like to thank all who has helped us with the Wolbachia program, whether it's international or local. And of course, I would like to thank my sincere thanks to the organizers of this webinar from the University of Gadjah Mada, as well as University Sumatera Utara, and also TDREC, Dr. Natasha and Dr. What's her name, Mutiara Cinta, whom I have been disturbing them for the slides and whatever not. Thank you very much for your kind attention.
Thank you, Dr. Nazni. I'm biased toward your presentation because I'm also conducting Wolbachia, but this is a very impressive presentation whereby we can see that if we conduct it properly, we will have achieved a good result in preventing dengue. So thank you very much, and I will move to the next presenter because we have 4 presenters. We will go to the third presenter. The third presenter is Dr. Agus Handito. He's from the Ministry of Health of Indonesia. He's a senior epidemiologist at the Teamwork, or in English, usually we call it Subdirectorate Arboviruses in Ministry of Health. He's also head section of Arbovirus Prevention Subdirectorate, Arbovirus Disease Control Directorate, CDC, with the expertise of epidemiology, health information, monitoring, and disease surveillance system. He will present a lesson learned from Indonesian effort on mosquito-borne disease prevention. You have 15 minutes and the time is yours, Pak Agus.
Ya, thank you, Pak Doni. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good day, all the participants. May I It's clear?
Yes, go ahead, Pak.
Okay. Yeah, thank you. Okay, thank you for this opportunity. I will start with the map of Indonesia. As all the participants know, that Indonesia is a huge country, very, very huge country with the tropical climate. And then that's growing up population. And there's the others feature of our country. So for the national, we have national dengue prevention and control strategies, which is we have six strategies. The first is factor management, the second is surveillance, the third is management, the fourth is community participation. That's I would like to talk about the community development in mosquito nest in dengue for 3M, 3M plus with one house, one dengue cadres, or we call it gerakan satu rumah satu jumantik. And the fifth is program management, partnership, and government commitment. And the sixth strategies is research and innovation. Oh, sorry. So for dengue killers, we call it jumantic. Jumantic is a mosquito larva monitor who carry out the inspection, monitoring, and education of the mosquito larva, especially Aedes aegypti and Aedes albopictus. Its family member can be involved in checking, monitoring, and eradicating mosquito larvae in the residence by PSN TM plus regularly. We call it PSN for pemberantasan sarang nyamuk. Okay, in the community, as a community-based early warning system, the cadre will make a situation for the stage safe, alert, and danger. For the safe stages, we have four indicator. Free larva index above 95%, and then no suspected dengue fever cases found in the past week, and then room temperature 24 degrees Celsius, and 2000 to 27. And rainfall in the past week is only one time. And the stage of the alert, uh, we have five indicators of free larva index above 90 to 95%. There is one or two suspected dengue cases found in the last week. And then the room temperatures above 28 degrees Celsius. And rain in the last week 2 or 3 times. And water lodging for more than 24 hours. At least two of the five criteria are met to be considered as alert. And then the dangerous stage. The six indicator are free larva index below 90%, three or more suspected cases of the dengue fever have been identified in the past week. At least one person hospitalized with a dengue diagnosis, and room temperature above 32 degrees Celsius, rainfall in the past week more than 3 times, and that's due to dengue fever. At least two of the five criteria are met, or one that with a dengue diagnosis is identified. The status is considered dangerous. So for the malaria, we have a different perspective about the malaria cadres. Based on Ministry of Health Regulation number 41 of 2028, considering sorry, 2018, I think, concerning of the implementation of early detection and administration of antimalarial drugs by malaria cadres in area with special circumstances. And what they have to do, the cadre is a non-health worker tasked with conducting malaria control activities in the form of detection and administration of anti-malaria drugs in the identification and management of malaria cases. The authority of the malaria cadre is detection of malaria cases through home visits, diagnosing malaria using rapid diagnostic tests, finger prick blood collection and preparation of malaria blood, administration of anti-malaria drug, and monitoring the intake of malaria drugs by recording and reporting data. And the accountability, their activities in early detection and administration of anti-malarial drug in area with special circumstances are under the supervision of the local health center staff. The district health office is responsible for implementing the authority of malaria cadres. So the activities carried out by malaria cadres is they are PCD, passive case detection, which is the detection of cases when patient come to seek treatment and help at the health care facilities. And the active case detection, which is when cadres or health workers home visit to conduct screening for malaria symptoms. And the medication monitoring activities are if a case of malaria is detected, health worker gave the malaria treatment guidelines. Cadre serves a medicine monitoring program, we call it PMO, to ensure that the medicine is taken according to instruction. During treatment, malaria patients must be monitored to determine the progressive of their illness. The result of the activity are recorded of in a form. And for the vector control activities, especially for the Anopheles, vector survey, which involves observing the environment to identify mosquito breeding sites. And this is one best practice from the South Tangerang city, which is have the good uh, society or community empowerment Lava Volunteers. This is the organization Lava Volunteers. They have surveyor independent and the daily working group at city level, and then sub district level, and then the village level until the coordinator for the Dengue cadres. And this structure is under supervised by major, sub-district head, village head, and sub-village heads to the community leader and society head of the family. This is the coverage of the activity of the monitoring larva at that area. If we can see at the table, the 2024, there 30%, which is 2030 sub-village free larva certified, and then the target of 2025 is 50%, which is 3,083 sub-village free larva certificate. And if we see about the number of the total of sub-village at South Tangerang City is 766. And until July, we have 2,067, which is 34.86%. And then the daily cases until July 2025, they have for 57 cases, and then we know that the dengue death at the Tangerang, South Tangerang City from 2022 until now, 2025, is zero. Yeah, this is some activities from their society, and if we can notice the with the bee cell, they are genetic cadres for dengue, and their activity in the sub village. So I think that is my presentation. Thank you for your time.
Thank you, Pak Agus. It's very interesting presentation and lesson learned, because here now we understand that to be able to have to control dengue effectively, we need to have an organized community. We have to mobilize community consistently, so we can control the factor. So thank you very much for the presentation, and I would like to move on the fourth presenter. This is the last but not the least. Now we will discuss more about the partnership, and it will be presented by Bapak Sugiarto from the Ministry of Health Indonesia. He's the health entomologist from Vektor and Disease Carrying Animal Control Unit, Directorate of Environmental Health, Ministry of Health, Republic Indonesia. He's also a principal investigator in national studies on Aedes aegypti anopheles species related to dengue and malaria transmission. His research expertise is on vector surveillance, insecticide resistant, and also contributor to our national guideline on dengue, malaria, cockroach, and fly control at the Ministry of Health of Indonesia. So, Pak Sugiarto, you have 15 minutes for presenting your works, and we will follow up with discussion. The time is yours.
Ya, thank you, Prof. Doni. Ya, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Ya, good afternoon, everyone, everybody. Ya, okay. I will to present about yes, it's split, Prof. Doni.
Yeah.
Okay, I will present about the strategic partnership and future direction in malaria and dengue vector control. This is my curriculum vitae, and I have five subtopic. And the first is vector-borne disease in Indonesia, and second is the surveillance information system application for vector-borne disease. We call the Silantor, and the third strategic partnership and collaboration in malaria and dengue vector control. And the fourth is rebranding, ya, pengendalian sarang nyamuk 3M plus gitu ya, source reduction to the Aedes population. And the last is the larva free village is the new program from the vector control program begitu, and we call the kampung bebas jentik. Nah, okay, this the first topic. Vector control is still the remain a problem in Indonesia. Malaria, dengue, chikungunya is the still a problem in Indonesia. And we have now the vector-borne diseases are influenced by environmental condition, such as malaria is the vector is anopheles, and breeding place is unfisheries lagoon, and tambak emas gitu ya. And the dengue and chikungunya, the vector is the Aedes. Breeding place is the container, container in outdoor and in indoor. And the next is the Japanese encephalitis and filariasis. Vector is Culex. Breeding place in the shower and then in tertiary. Nah, in MOH, we have the system information. We call the Silantor 2.0. Silantor is a surveillance information system application for vector-borne disease. Silantor is the operation by health center, and we have to monitoring the surveillance and intervention vector in the system in Silantor. In the Silantor, we have the health center conducts access to surveillance reporting and vector intervention. And the Silantor provides real-time information based on the free larva index. We call the angka bebas jentik for dengue, and the receptivity index for malaria, and then the success rate for leptospirosis. Silantor has also the dashboard, and display can be accessed by the public. The community and the cross-sector have received information about the vector, like the dengue vector, malaria vector, and the leptospirosis reservoir. This dashboard will provide real-time information based on the free larva index and the receptivity for index malaria and the success rate for the leptospirosis. The third is we have the strategy partnership and collaboration in malaria and dengue vector control. Like this, the letter to the major region regarding the awareness in increasing dengue case and the promoting the 3M plus program, source reduction, source reduction for vector control program dengue. And the collaboration meeting in the implementation of PNC 3M plus across sector and monitoring and evaluation to the prevention district, city health center, community health center, and regarding the free larva index and receptivity index. And the last is the technical assessment to provincial, district, city health office, and community health centers. And now, PSNT 3M plus, PSN 3M plus, source reduction of larva is one the strategic force mosquito program, especially for the vector control in dengue. Community participantly based on the survey Kesehatan Indonesia in the implementation of the PSN program is still low. Community participation that does not conduct PSN 79%. Community participation that conducts the 3M PSN in only 12%, and even less, only 8% implemented the 3M plus program. This is based on the survey Kesehatan Indonesia 2023. So we have the rebranding of the PSN 3M plus is necessary. PSN 3M plus is not yet optimal for controlling dengue infection. There is a gap in the PSN 3M plus message which has not been operational, carried out by the community. And the content of the plus message from 3M becomes a non-priority because the understand the plus is seen as optional rather than mandatory. So this the rebranding PSN 3M plus Jadi, the first is menguras dan menyikat. The second is menutup tempat penampungan air. The third is membasmi jentik dan menghindari gigitan nyamuk. And the last, we have the new program for vector control to malaria and the dengue. We call the kampung bebas jentik or larva free village. I want to show about the videos about the kampung bebas jentik. So we have the words.
Kampung bebas jentik. Apa itu kampung bebas jentik?
Kampung atau kawasan atau wilayah bebas jentik adalah kelurahan desa kawasan pelabuhan bandara PLBDN yang memiliki kemampuan, kemandirian dan sinergitas dengan instansi terkait dalam pelaksanaan program pencegahan dan pengendalian jentik sesuai dengan standar baku mutu kesehatan lingkungan Vektor yang berlaku.
Kampung bebas jentik dibentuk dengan mengaktifkan Pokja KJB yang melibatkan ketua RT RW, tokoh masyarakat, kader kesehatan, karang taruna dan unsur lain yang terkait. Bagaimana mekanismenya? Dengan memberdayakan gerakan satu rumah satu jumantik melalui kegiatan PSN 3M Plus rutin. Bagaimana kriterianya? Kampung, desa, wilayah dengan ABJ lebih dari 95% dan indeks habitat Anopheles kurang dari 1, serta melalui penilaian. Bagaimana pemberian sertifikatnya? Dari rumah-rumah bebas jentik kemudian akan tercapai RT RW bebas jentik dengan sertifikat dari camat. Tingkat berikutnya kelurahan atau desa atau kampung bebas jentik dengan sertifikat dari bupati atau wali kota. Berikutnya kecamatan bebas jentik dengan sertifikat dari bupati atau wali kota. Kemudian kabupaten atau kota bebas jentik dengan sertifikat dari gubernur. Hingga provinsi bebas jentik dengan sertifikat dari Menteri Kesehatan. Adanya kampung bebas jentik diharapkan dapat menurunkan penularan demam berdarah dengue dan chikungunya dan penyakit tular vektor lainnya.
Okay, like this the implementation and the larva free village and kampung bebas jentik in Indonesia. In the 2025, this the implementation trial in the 6 location and funding from CDC. Location is the Depok City, Jepara Regency, North Penajam Pasir Regency, Belitung Regency, Singkawang City, and Kendari City. And the project duration until the September 2025. The Kampung Bebas Jentik is the village or sub-district that possess the capability, independence, and synergy with cross-sector in the implementation of program for the prevention and control of larva in accordance with the applicable environmental health quality standard, or we call the SBMKL, Standar Baku Mutu Kesehatan Lingkungan for Vectors and the animal crying disease. And the purpose is the increasing community engagement of the public in effort to prevent and control vector-borne disease through the source reduction. Nah, thank you for your attention. We will back to the Prof. Doni.
Thank you very
Thank
much, Papa. It's a very interesting evolution from once vector control focusing on mosquitoes, the free larva, now moving to the free village. Now I will invite 4 speakers to discuss the questions from the participants. Mbak Rimaus, those who can we pin all 4 speakers so that we can all present in the same time, and we will share the question from the participants. First is from Novi to Dr. Ivana. How you assess the malaria associated with mental health? There is psychological instrument you use to assess the impact on mental health? How is the data interpretation? Dr. Ivana, you would like
Yes.
to respond to this?
Yes, thank you, Dr. Andon, and to Bu Novi. We assess the result, the findings of our interview, mentioning about when we're asked about their perspective of malaria disease, what they know about malaria, they associate it with mental health. Maybe it's due to malaria falciparum because it's infected to the brain, I think. It's not, which is not one of my expertise, but I guess it's what they are saying is because they can see some of the experience that may be affected by one of their neighbors or their family has the symptoms of having delusion or something affected their intelligence or their mental health. And that's what the perspective from the community. It's not using any other tools or psychological assessment, but we use our focus group discussion guideline. So one of them or some of them mentioning this aspects of their interpretation of symptoms of malaria.
Okay.
Maybe that answers the questions.
So this is more like a community perception on those issues. Yeah.
Yeah, and on malaria.
On
Yeah, because
malaria.
that's why they tend to have a traditional healers, not going to the medication. So they delay the treatment of the malaria. Well, but they don't have the access directly, or the facility is limited in their their village. So that's what impression that they get from the neighbors that they have. Some of them has maybe in that one area has the malaria falciparum with that condition. So that's why they say it's associated with the mental health.
Thank you very much, Dr. Ivana. Now, the second question is from Putro to Dr. Nazni. Dr. Nazni, is there any lesson learned challenges in the community stakeholders level in Malaysia, especially about community rejection on Wolbachia program? Could you share how your team and MOH overcome these challenges?
Thank you for the question. So far, in our research team, whenever we go and release the Wolbachia mosquitoes, we have encountered that not the community per se, the whole community's rejection. No, it's only individual, one or two individuals who do not want to accept our mosquitoes. So what we do is, at the first time we said that we collect the mosquitoes from their homes, then we check, we say this is not the mosquitoes we release, this is another species. But if you do not want the mosquito to be released at your area, we will not release. So we move from there, we don't release. That is what we do. And another time, there was another locality near Mentari Court, where the Wolbachia frequency was 90%, and the community says that they do not want the joint managed board and the community says that they do not want any more Wolbachia mosquitoes because they saw that the dengue has decreased, and they said there's so many mosquitoes, so now they don't want. They say they do not want the release, so we stop the release. Once the community said no, we stop the release. And after that, when the dengue cases come back, after sometimes they call us, they say they want Wolbachia mosquito again. So that is good, that is bad, okay? Then the third scenario which we have from our research is that there was a pest control operator staying in that area where we do our release. So of course, if it's a pest control operator where they use insecticides, they're not in favor of Wolbachia mosquitoes. So they do not want the release. So what we do is, then they ask the community saying that, oh, these mosquitoes, female and male, both are biting. So what we do is, we know there are cases there. So what we did was we changed the strategy. In that particular block, we release only male mosquitoes so that they are not biting. So that's how we manage. And from the Ministry of Health, I think so far there was not, there are communities who do not want, but they do overcome and they do complete the Wolbachia releases. Yeah.
Thank you very much. Can I add a bit questions? Do you also experience about disinformation and hoax that can become a viral and create a strong rejection in the community, or it's just
Yes,
our experience?
there is
Uh-huh.
a community. There's an artist actually, but
Uh-huh.
from one of the this Rejang, I've shown you the locality. He viral it into the Facebook of Ministry of Health, and he says that we are doing very whatsoever job he comments and whatever not. So what happened is the what do you call, the PKD, the district officer at
Mhm.
that particular place went to the house and asked him questions and put another traps to see what are the mosquitoes and show him that these are not the mosquitoes we are releasing. So after that, when he knew, he stopped his viral thing. We have to
Okay.
educate the community. We have to go to the ground and see. Then after that, he didn't make any more viral statements in the Facebook.
Okay, thank you very much. So, thank you very much for the answer, Dr. Nazni. And the next is from Julie to Pak Agus. When the Wolbachia pilot project at cities were performed, do the cities still practice the traditional method to control dengue, which is fogging, household insecticide, mosquito nest eradication in Indonesia? And what if the non-Wolbachia mosquito bounce back and grow in higher numbers? Pak Agus?
Yeah, thank you. Yeah, actually, is Wolbachia is not a single factor dengue control, but Wolbachia is a complement with other dengue control. So in this area,
Mhm.
with the implemented Wolbachia, they still use the factor dengue control, but they really pick the appropriate method, such as when we know that the Wolbachia is versus the other mosquitoes, so they don't want to use fogging. I mean, if they need fogging, they will not use this method at the release point. They will use other method of the dengue control, factor dengue control. And if they will use the other of the method, they will make consider of the method who will most appropriate with uh, their situation. And sorry for the second question.
If the natural mosquito bounce back, will it be happen, and how do you will manage that?
Okay, you mean in that piloting project area?
Yeah, yeah, yeah.
Okay, yeah. So please God, don't don't make there will happen. Yeah, because I think if we consider about apply this method, we have considering about all the scenario, but if they will be like that, so uh, you know, we consultation to the expert for the best solution of that. I think that is not the good answer, but that is the answer that I can give. Thank you.
Thank you, Pak Agus. May I add a bit information on that, Pak Agus? So, based on our studies, when we did the clinical trial on the technology, the intervention is based on top of the existing dengue vector controls, meaning it's the same with the PSN, 3M, and everything. So it's as you mentioned, this is not substituting, but it's more complementing. And also based on our experience, once the Wolbachia established, usually it remains high. Even in our small release area, in the first small release area in the hamlet area, since 2013, we still find a very high Wolbachia frequency in those mosquitoes. So though there is possibility or probability that it might decrease, the probability is very low. At least that's what the evidence show at the moment. So that I think it's more on the evidence that we have currently. So I hope that also answers.
Thank you.
Thank you very much. And next, this is anonymous for Pak Sugiarto. If the CDC no longer provides funding for the larva-free villages, where will be the funding for the mosquito-free villages come from? Is there an exit strategy to ensure the program sustainability? This is very, very important questions.
Okay.
Pak Sugiarto?
Yes. Thank you, Prof. Doni. Yes, it's the fact and the relation. The CDC is is only the initiation funding. Yes, we hope is that this program is sustainable. Currently, we have sent a letter to the major region to implementation the collaboration program for dengue to the KBJ. KBJ is not a new program, but rather on the appreciation and collaboration program from Jumantik, Gerakan Satu Rumah Satu Jumantik, and the other existing vector program control in the for the control of dengue. So we exit the strategy is we have to increase the collaboration about the other sector to implementation the KBJ in the next. We done we done the only the CDC funding, but we have the funding to APBN or APBD. Yeah. Like
Okay.
this, like that, yeah, like that.
Thank you, Mas Garto. So,
Yeah.
this pilot is more showing the evidence. So when you have the evidence, it can be uptake into existing program with the existing funding scheme. I think that's also ensuring the sustainability. Do we still have additional questions? Okay, so the next is from Putri to Dr. Ivana. In the context of increasing community vulnerability to zoonotic malaria transmission due to land use changes, how can cross-sectoral policies be designed to minimize disruption to natural mosquito control?
Yeah.
Dr. Ivana?
Yeah, I think we still need to include multi-stakeholders, and it should be regularly conducted in the meeting involving the Department of Forestry, District Health Office, influential community, cultural and religious leaders should be also involved, head of the sub-district, to sit together and then pass the research findings based on the evidence, satellite geospatial information, and also surveillance data. And it should be well informed, considering the sensitive and culturally appropriate manners. I think a regular term and then using the role of the population and the key of the leaders in the community that can be trusted by the community, so they can understand why this is important not to cross the restricted area, because we can get this disease. This is a new disease. We can spread and become a new hotspots to the community. I think it should be well informed to the area, which is we already can identify this is a high risk zone of zoonotic malaria.
Thank you.
I hope I
So
can
this
insert.
approach, yeah, So the cross-section sectoral approach is even more critical nowadays, right?
Yeah, we can solve problems or help problem only by ourselves, but we need to collaborate with many other experts because we cannot have our own effort, although we are very expert in one thing, but we need other expertise to help us to think and then to find a solution.
Okay, thank you, Dr. Ivana. Next question will be from Adi to Dr. Nazni. Is there any prediction about what percentage of Aedes mosquito with Wolbachia initio will be by 2025? Has there ever been a decline in the population of Wolbachia mosquitoes? Dr. Nazni?
The first question is tough. What is the percentage of Wolbachia mosquitoes in the nature? I'm sorry, there's no prediction yet, but I can say that whichever localities we have released the Wolbachia mosquitoes, the Wolbachia mosquitoes still remains because we are doing our monitoring from time to time. But how many percentage is that? I'm not sure. Unless I add up all the frequencies, then that we will know the percentage. Okay, the second question is, whether there is a decline in our Wolbachia mosquito. Yes, there is a decline, and I have shown you that when there is a fogging in the what you call nearby, when there's a fogging nearby, because that area is a hotspot, at the buffer zones, when there's a fogging, definitely the fog spill over to the Wolbachia areas, and there's a decline in Wolbachia mosquitoes. But interestingly, in all our research areas, the Wolbachia mosquitoes rebounds back. We don't have to do any further releases because we have released them for some times, so there is no bounce. By itself, it will come back. But if in our research, in our operational ataupun in our implementation sites, we do booster releases so that because sometimes the mosquitoes has reached as low as 2% Wolbachia, so it's not easy for it to pick up. So that's why we do the booster releases for 6 or I think sometimes 6 releases, so it picks up again.
Okay, thank you, Dr. Nasi. And I would like also to add, it's a similar happening in our experience. The reduction can be a natural population dynamic in the mosquitoes, but in the long run, the trend will be a stable frequency of Wolbachia, though we have fluctuation from time to time.
Yep.
Thank you, Dr. Nasni. Next, to Pak Agus from Anonymous, how to make the findings from the field, especially from malaria cadres, could be used as data decision making. Pak Agus?
Yeah, thank you. Of course, as I mentioned, but for the malaria cadres, they will conduct the testing for using rapid diagnostic test and then monitor the treatment of the malaria and monitoring the larva. For example, they found from the form of the monitoring about the compliance of drug of treatment of malaria treatment, they find that there is some patient of malaria patient, they have not good compliance and they have to report to the health worker, health staff, because the cadres is below the supervise of the health staff, and then the health staff will notice and try to find the best solution of that situation. So, I mean, the result of the cadres that what have they found in fields will make a decision of the program of the malaria control. Thank you.
Thank you, Pak Agus. Next questions. Oh, Mas Dodi. This is from Rustamaji to Pak Sugiarto. Is there an example of questionnaires for creating a KJP? I would like to adopt it and develop it with the modified form that minimize mosquito larvae so that KBJ can be realized more quickly. Pak Sugiarto?
Yes, okay. Okay, Prof. Doni.
Yeah.
Yes, exactly. And now we are currently finalizing the KBJ guidelines. We hope after the finalizing the KBJ guidelines, the district can follow the KBJ guidelines, and please wait for the further information from the MOH about the KBJ guidelines. Like this, Prof. Tony.
Okay, thank you very much. I hope that answered the questions, Pak Rustamaji. Is there any more questions for the speakers? We still have 3 more minutes for the Q&A. There is no? Okay, there is one question from the chat. Are there any challenges in implementation of Wolbachia mosquito, especially in outside Java Island? Perhaps it would be appropriate for Pak Agus to respond. And also, is there any risk or negative risk in the long run for the technology?
Yeah,
Pak
thank
Agus, you
you.
want to respond on that?
Yeah, thank you. For the first question is about the yeah. Actually, there is some difficulties for us in the field when we applied the pilot project Walbahia. For example, there is such as hawks that they have negative rumors about the Walbahia, and then about the uh, in the you mean the uh, in the place uh, only Kupang and Bontang. That place, the uh, between community, there is several uh, uh, what is for the I mean uh, they have several leader, society leader. I mean, not formal leader. Yeah, they have a different perception about that. So we have to make their perception become one perception. I mean, how we tend to make their accepted this pilot project. Because I think the difference of culture in Java and the outside Java, yeah, and so the people is different. And about the yeah, I think if we apply the Wolbachia method, it will know in long term. That method will apply in certain time. I mean, not in a long time, because for the study, the Wolbachia method will be conducted in only 6 to 8 months. Am I right? Not all a long time. I think that is my answer.
Thank you, Pak. So yeah, it's well, the challenge is slightly different, but in principle, it can be happens in every place regarding the community perceptions, cultural sensitivity, and everything. So we need to address accordingly. And because our time is already up, so I will try to short summary this session. We can see here from all the presenters, the main theme that we can have is that to be able to successfully control the factors, we need to change the behavior of the community systematically, extensively, and continuously. And if we don't have a good community engagement strategy, that is impossible, be it for the Malarian Plasmodium knowledge, which also involving human interaction with wild animals. Well, the Wolbachia mosquito is more like acceptance of the technology, or larvae village, which include uh, changing the behavior of all the communities. So the presentation of the speakers highlight all the importance, and I would like to thank you for all the speakers for the excellent presentation and valuable knowledge sharing. Thank you very much, and we give a big applause for the presenters and also the participants, which still have a lot of enthusiasm until the end of the session.